Just hi, everyone, once more. My name is Pauline Irungu. I work for PATH. I'm based in Nairobi. I'm a global policy and advocacy advisor. I think I've worked with a lot of you, and some of you, you're new, but welcome to this second part of the Data Resources for Advocacy webinar series. That's we are aiming at sharing tools and data resources that enable us support our work on advocacy for women, children, and adolescents' health. And just maybe by starting off with quick logistics, this webinar is being run in 2 languages. We have English and French. If you go to the bottom of your screen, you'll see a small circle that then it looks like a globe. You can just select the language that suits you best. So please go there and select your language so I can be able to listen to the right channel. Secondly, we welcome your questions. We want to be as responsive, as interactive as possible. So please put your questions on chat, but and towards the end, we'll have a session where we respond to questions. And finally, I just want to ask you to introduce yourself on the chat as well. So put your name, your organization, and where you're calling from or the location where you work so that we get a sense of who is on this call today. And I think with that, let me just quickly run you through, introduce the team, as well as share the objectives for this session. So this is the second part of this webinar series on data resources for advocacy. We held our first session in October on 4th, I think, and when we discussed a specific tool, the GFF data portal. And today we're doing what we are calling the data resources 101. This session, this webinar series, you know, is a collaborative effort of PAI, the GFF Civil Society Coordinating Group, the GFF itself, the Secretariat, PATH, Global Health Visions, UNICEF, WHO, Countdown to 2030, and RMNCAH. So we're really excited as a team to be working together to bring this series to you. So today, to take us through this session, we're joined by a panel of experts drawn from WHO, UNICEF, and Johns Hopkins University School of Public Health, or who will take us through the different resources to enable us to better navigate these valuable tools that support our advocacy. So a team of experts that's joined me include Bo Beshansky-Pedersen, who is a household survey expert consultant from UNICEF headquarters. He's part of the multiple indicators cluster surveys team, and he'll be walking us through the multiple indicators cluster surveys, which people regularly call MIX, and he'll take us through the overview, access, and also help us with learning about the navigation. Secondly, we're joined by Dr. Dazen Yu. He's the Chief of Demographics and Senior Advisor, Statistics and Monitoring at UNICEF. Will talk us through the tool called UNIGME that looks at stillbirths, child health, adolescent, and young mortality and youth mortality estimates of the United Nations Interagency Group for Child Mortality. Dr. Teresa Diaz will join us also, who is from WHO. She is the Unit Chief Epidemiology and Monitoring and Evaluation Department of Maternal, Newborn, Child, and Adolescent Health and Aging at WHO, and she'll be taking us through the WHO SRMNCAH Policy Survey Database. And finally, Dr. Jennifer Rikijo from Johns Hopkins Bloomberg School of Public Health will be joining us on behalf of the Countdown team, Countdown Profile Production team, and to walk us through the countdown to 2030 country profiles. So just to quickly go over the objectives, I just want to remind you of the overall objective of this series. This series really is geared to enabling us to, as advocates, to increase awareness and access to key data resources and tools to support evidence-based advocacy for reproductive, maternal, newborn, child, and adolescent health and nutrition, and with a particular focus on GFF countries. But those of us who working in other countries, they'll also benefit greatly from these tools. So just for the specific objectives, we have about 4 of them, is just to get an orientation as civil society and youth advocates to several different resources and tools that provide multi-country data and evidence to add to us and other stakeholders at the country level. To discuss the role of data and evidence in supporting and strengthening advocacy. If you ask me, really, data is like a seat on which advocacy must sit so that it can have legs. And then to explore the appropriate use cases for the different data resources and tools to increase access by advocates, share specific examples from countries, and to help us learn from one another. And finally, to introduce advocates to a simplified matrix summarizing appropriate use cases for the data tools. Some of you have already received this matrix, but we'll be sharing it once more, and feel very free to share it with as many as you can in your networks. I think I'll walk you through quickly the session plan. This particular webinar has 2 parts. We got part 1 where we're looking at overview of primary resources for RMNCAH and nutrition data. That is the mix, the UNIGME, and the WHO SRMNCAH policy survey database. So that forms part 1. Then we'll look at part 2, which is looking at the overview of select dashboards and visualizations and country profile tools. And the third part will be the open discussion so that we can get more clarifications on questions that we have, or then provide additional comments and inputs to the team. Thank you very much. And with that, I welcome the first presenter. Bo, over to you.
Thank you very much. I hope you can all hear me.
Absolutely.
Thank you. It's a pleasure to be with you today. Yes, I am going to talk briefly about the multiple indicator cluster surveys. I'm quite certain that many of you have heard about this survey program before, but we will look at a few of the basics just to give you an introduction. I was thinking about what I could show you within the allotted time, and it's difficult. I can tell you just as a quick starter for you that I'm currently finalizing together with a country statistics office a final report of a survey, and it's 750 pages. I don't think we have time for that today, so I'm just going to walk you through some of the basics and the coordinates, so to speak. I am not sure I can control from here. May I have the next slide, please? Thank you. So if you do not know, the mix is what we can call, at least unofficially, the UNICEF's Global Household Survey Program. It started in the early 1990s, specifically to address the indicators that were agreed upon in the World Summit for Children. Basically to track progress on a very limited number of indicators. And back then, for those of you who are of my age, the idea of having global indicators was relatively new and having harmonized data. So this was a very first step. But the very first mix sort of rounds, as we can call them, in around 95 and 2000 were, I would say, not very well coordinated. They were very designed to deliver specific outputs to track the indicators here. But then as we move beyond this, there was the onset of the Millennium Development Goals and now rolling into the Sustainable Development Goal indicators. And that's really one of the core tenets of the program now, as well as a multitude of other indicators, obviously. You see the little map there, which we have on our website that I'll show you later in the presentation. But we don't cover all the GFF countries, but and some of these countries have not done a survey in a long time, but broadly speaking, quite a variety of countries, 118 until now. Next slide, please. So here in the red chart, the red colored chart that you see here, we have the number of surveys that were completed, or well, for the most recent surveys, those that have been started in the different rounds. If we put a focus on the latest round, you can see that there's quite a higher number of surveys in this round, but the round was also extended due to a little issue of a global pandemic, which put issues in implementation for all of us and all of our work, obviously. As you can see, the present round is just about to complete in 2 weeks, more or less, and we are about to begin the rollout of a new round of the survey program. When I say a round, it means basically something that's slightly internal to us. It allows us to update our questionnaires and how we do certain things basically in mix. In terms of content, meaning what indicators that will be collected, there are changes too, but these are more on a rolling basis, so that we don't just change things every 5 years, but there's an ongoing effort to address whatever is the ongoing demands on data from mix around the world. Countries participate on a demand basis. It's not all countries that participate in every round of surveys. It all depends on national statistical plans and needs of whatever monitoring mechanisms that countries wish to utilize the mix for. As you can see, we have, let's call it 60-65 surveys per round, and we are expecting this to also happen in the upcoming round. What is important to know about the mix program is that we, from UNICEF side, are building the tools and the program and provide technical support through a collaboration framework with countries, but the countries predominantly 9 out of 10, even more cases, surveys are implemented by the national statistics offices and with technical support from the global mix team. Funding comes from many sources. Increasingly, countries are putting the mix survey into their national plans and at minimum co-funding the survey. So it's not per se a UNICEF-funded implementation. The most important box, I think, for today is really what I put in the lower left corner, and that is that mix is, in short, an indicator-based household survey program. We do not have questions in mix that do not contribute to the computation of a globally defined indicator. So with the topics that we're covering today on reproductive, maternal, newborn, child health, etc., and nutrition, these are all globally agreed upon indicators, which is why we have come such a long way from the 90s, where harmonization of data collection tools and reporting through indicators, we have come a very long way in the sense that most global household survey programs and efforts locally in countries or regions are quite harmonized. We pride ourselves to be in close collaboration with the demographic and health surveys of supported by USAID, and it will continue to be like this because we like to have sort of what should I call it? Obviously harmonization, but also an interchangeability between our different programs, so that we to some extent can add and subtract between our different efforts over time. The demographic and health surveys have more of a focus on the reproductive health side, whereas mixed being a UNICEF-led survey has a higher level of child focus, but there is quite an overlap. think perhaps some of the latest estimates would be that we cover each other more or less 50%. Next slide, please. The next slide, if you can see it, because I cannot.
Sorry, there is a small freeze here. It's coming up.
Okay, it's coming. I can tell you, if I remember correctly, that it's just a very basic overview of how the process of mix is functioning. Basically, from our program, we deliver a set of tools that is relating to the actual content of the surveys, meaning questionnaires, the questionnaire modules, the individual questions, response categories, etc. And everything that it takes to implement these questions, being the computer applications that is used to collect the data, to process the data, etc. But to run a household survey program is very much more than that. So it comes with a broad range of tools that has to do with how you plan the survey, how you set up the governance of a survey, how you design the sample of the survey, how you disseminate, how you report, how you archive, how you analyze. It's an enormous program, and I will show you just a very short glimpse of that. But as I said, if we look at the second column here, basically, we are looking at on-demand participation and collaboration with countries, which we generally do together through UNICEF country offices by going through these data gap assessments, we call them, where we try to look at whether it makes sense to do a mix or not, whether it makes more sense to wait a number of years or to integrate some of the mix-specific indicators into other household surveys, or to simply not do a mix. One of the key aspects of mix, I think we can say, is that we try to stay away when we are not necessary. I'm taking quite a pride in that. But other than that, mix functions more or less as any other household survey, in the sense that we have, as I said, the amount of field work. We try to limit the sample. We try to cover as much of the country as demanded. We don't go in very, very long field work because we have experience with that, etc. It's all about attempting to get the data in the hands of users as fast as possible. We're not always very good at that, but that is a key objective of our program, to be able to deliver results and data as fast as possible. Below in the middle here, I'm just putting that we are not that many people working on this. We have a staff component in New York that is quite small. We work with our different regional offices in UNICEF, and then a number of expert consultants, one which is me working for HQ, and obviously through our country offices. We're quite small, but it functions very well for us. But if you have any available money, I will give you my bank account details. That would be nice. Next slide, please. So mix is not just about our core work in the household survey program itself. That's basically the very first bullet here, where it says mix 7. But we have what we tend to call a family of products. We also do Mix Plus, which is a survey over the phone. We do Mix Link, at least what we call it, where we try to connect the mixed data to administrative data. We do what we call Mixed GIS, which is to geocode the mixed data so that further analysis can be done, and what we know as small area estimation can be performed to create more disaggregated data than what a household survey can do. And finally, I think what many people here would be interested in is a project on creating a tabulator that is an online platform on harmonized data, where you, through some different tools, can utilize the complicated for some microdata and create your own cross tabulations. If you want to know, for instance, how many women in Ghana, aged 24 years old, who live in a house with a TV and who have a child who goes to the first grade of primary school, you could produce that from this. And you can, of course, many other things, including computing the standard set of indicators for multiple countries in one go. That is something that we're very excited about. It's also something that takes a very long time to put together. Been working on this for years, but we expect the first products to begin coming out in 2023 through an online platform that you all would be able to access. Next slide, please. Here I just put a couple of links. The very first one I will show you in a second, just very quickly, a couple of screenshots. But there's a number of good links here to understand more what MICS is, with some example utilizations. The very first one has to do with impact of MICS on collecting information on drinking water quality in Nepal. There's a little video, and I think that would be interesting for most of you to see. Next slide, please. This is where you land if you type in mix.unicef.org, the MICS webpage, which is also undergoing some redesign now that we expect to be finished sometime early next year. If you click one more time or even two more times, you will see that the main parts of the website that has lots of information is the tools section and the survey section. Please click forward twice. You will see them indicated with a circle. Could you go forward a couple of clicks, please? So here is what it looks like when you click the tools link. These are the latest tools that are available for this present concluding round of MICS-6. You will see the different tabs above. If you can go back one, please, to the tools page, you will see that there is a tab for survey design, which is where the page is on now. There are tabs for data collection, data processing, analysis, and reporting, and all of these have all the available MICS tools, including questionnaires, list of indicators, which is key to understanding our program, shown, and you can go and pick up the tools in the five of the 6 UN languages. Although we have a few tools available in Chinese, it is not our focus for the reason of demand, of course. On the next page, the surveys page, this is where we post all of the surveys. Right now, we have 373 rows here, all of the MICS surveys that have been completed or are in planning, officially in planning, I should say. There's quite a number of surveys that we know will take place, but we don't have an agreement signed, so these are not shown on the webpage. This is the very top, so you see some of the MICS surveys that are currently in planning. But if you go to this website and scroll down, you will see reports available and data sets available in the 2 last pages. That is all that I have for you. I can talk about this for many weeks in a row. If you have any questions, please ask in the Q&A. I'll do my best to answer. Otherwise, you are most welcome to get in touch, and I will be happy to elaborate. Thank you very much.
Thank you, Bo, for taking us through that and making it very simple and straightforward. So if you can, I think, take us to the next slide so that we bring up the next presenter. So Dr. Yu, over to you.
Thank you very much. And I I'm very pleased to present the estimation work of the United Nations Interagency Group for child mortality and for child mortality estimation. We call it UNIGME. Next slide. So the UNIGME was formed in 2004 with 3 objectives. The first one is to produce consistent estimates of stillbirth and child mortality for about 200 countries in the world for reporting on progress on child survival at global, regional, and country levels. And the second goal is to improve methods and the measurement for stillbirth and child mortality estimation. And the last but not the least is to build and enhance capacity of countries in data collection, data analysis, estimation work, data systems strengthening, etc. And we have 4 members, including UNICEF, WHO, World Bank, and also the United Nations Population Division. Next slide. So I already talked about the 3 goals that also our work scope. And for methodological development, for example, we worked on stillbirth definition recommendation, like to make recommendations to WHO to simplify the definition and the measurement, and the other methodological work that we are conducting. And for estimation and global monitoring and reporting work, we produce estimates for stillbirth and also for children aged from 0 to so children, adolescent, and youth, age from 0 to 24. So it's a wider age range. Of course, we are also working on producing subnational level estimates, and also by other disaggregations like wealth quintile, etc. And on capacity building, we provide countries with technical support in various areas, through country missions, regional workshops, and also remote technical support. Next slide. So regarding the UNIGME data and the estimation process, first step is for us to compile all the available data produced by countries or other partners, and from various sources, including vital registration system, sample vital registration system, household surveys, census, etc. And then we process the data, we recalculate indicators, and do quality assessment, etc. Then we use the empirical data with high quality to build our model and derive a smoother trend line, and also extrapolate to the current year, which is usually a year before the current year usually. So then we do the publication and publish the estimates and the relevant methodology and relevant documents as well. The more important thing I want to highlight here is that the process engages countries through a country consultation process. Next slide, I'll talk more about the country consultation process. Yeah, so the country consultation process, the purpose for it is to inform countries about the forthcoming estimates generated by the group, and also to provide opportunities for countries to share feedback on the data that we compiled, and also the UNIGME estimates. And we usually identify focal points through Ministry of Health via WHO, and then UNICEF on behalf of the UNIGME to send the country consultation emails to Ministry of Health, and also National Statistics Office focal points, and also copy the country SDG monitoring contact person. And also we organize regional workshops, webinars, to explain to countries and the partners regarding the methodology and the process. Countries are usually given 2 months to provide feedback on new data. It varies. For some specific years, we may shorten the period. Next slide. I won't talk in details about the data source here, but just listed, what we collect from different types of data. We collect nationally representative data for national estimates. Now for subnational estimation work, we also collect at a subnational level. Next slide. We conduct data quality assessment, which indeed is a critical step in this estimation work. From the chart on the right side, you can see the wide range of data produced by different household surveys in a country. These are all real data. And for example, in around 1990, you can see that on the final mortality rate is from 100 to 250. So there are large discrepancies between the different data sources. So we need to really understand which one is more reliable, what we can use before we can do any modeling work. Next slide. So we often were asked by countries or others, why we use a model to derive child mortality estimates when countries already have some empirical data. So there are multiple reasons for it. The first one is that many countries indeed lack of a single source of high quality data covering the last several decades. The chart I just showed indeed is a good example. In many low and middle income countries, we lack of good, very well-functioning civil registration system that accurately record all births and deaths. And the second reason is that the data quality issues, as I already mentioned earlier, so we needed to really understand the discrepancies across different sources, etc. And the other reason is that the empirical data are usually not timely. We have some time lag, from household surveys or census, or even for vital registration data, we may have a year time lag. And we also need to have consistent trend line to monitor progress over time for SDG goals, etc. Yeah. Next slide. So I won't talk about our methodology, but just listed here the models that we use, that we have all published, the journal articles. You can look into, if we go to the UNIGME web portal, I will mention in a minute. Next slide. So this is the landing page of the UNIGME web portal or data portal. So it's childmortality.org, and we include all the relevant information in this website. Next slide. So here you can find the empirical data that we compiled, and also the UNIGME estimates, which is the blue line. Here you can see, and with uncertainty ranges is the gray area. One is the uncertainty ranges that the UNIGME generated around the estimates, but other lines and the points are empirical data, and then you can see also some wider range for this country. And if you click now on the top and you click charts, estimates, source data, you will see different the tables or different figures. So you can also download from the data from this website. Next slide. Yeah, we also have analysis section. This page shows the some analysis for the subnational estimates that we generated for over 20 countries, and really show the wide range within a country across different provinces or states. You see the mortality level, wide range. Next slide. And we recently added the stillbirth country profile. We are going to also soon add a country and a regional profile for child mortality indicators for different age groups. And next slide, we have the relevant resources available on this website, actually including publications and the tools, etc. Guideline books, for example. Then the next slide will show us the methods section. I have some explanation regarding the methods we used. Next slide. I think that's it. Yeah, if you have any questions, I'm happy to address today here in the webinar, or you can write to me, and I'm happy to answer any questions after this webinar also. Thank you.
Thank you so much, Dr. Yu. If you can take us to the next slide, please put your questions on the chat as well as comments. So over to you, Dr. Diaz.
Hello, everybody. Today, I'm going to speak to you about the Sexual Reproductive Health Reproductive Maternal Newborn Child Adolescent Health Policy Survey. Next slide. So the objectives of this survey is to, the purpose is that the Global Sexual Reproductive Maternal Newborn Child Adolescent Health Policy Survey is to monitor the existence of relative national SRMNCAH laws, policies, guidelines, and strategic plans, and country progress in adapting or adopting WHO global recommendations, and understanding the policy, legal, and environment that can enable achievement of the objectives of the global strategy for women, children, adolescent health, and for the SDGs. The survey contributes toward reporting the indicators for the World Health Organization Global Program of Work, but also in general. Populating of the WHO SRMNCAH policy database and national document repository, which is a unique global resource that I'm going to go through. And it also provides information for Countdown 2030 country profiles that you will hear about later on. Next slide. So the survey was conducted and will be conducted periodically. We had the 5th round of the survey in 2018 and 19. And that was the first time that we actually did this with sexual reproductive health. And the previous rounds were done in 2009, 2011, 2013, 2016. And then, as I said, we have an upcoming round this next year, 2023. So the WHO country regional offices are the main focal point for coordinating administration, but it's the Ministry of Health who is informing as to what the policies, guidelines, and laws are. And we have several different modules. There's a cross-cutting one, but then there's a specific one that looks at maternal newborn health, one that looks at child health, one that looks at adolescent health, one at reproductive health, and we also look at gender-based violence. And we have a publication that explains the methods for the survey, and it's actually out. Next. So in our portal, when you go to this portal, you can see, and we will provide all the links are here, you could see several different things. First, there's a document repository. What does this mean? You have 5,000 documents from 140 countries that shows you the actual policy, the actual law, or the actual guideline that they are using in that country. And then we have a portal where you can visualize the findings, and we're going to show you that in a bit. But you can click on a country and it can tell you about a specific policy that you might be interested in. Or you can click on more than one country and compare, and we'll show you that. We also have country profiles for each country. So here's an example of Ghana, and you'll be able to go there, go to your country's profile, and you can actually download a PDF of your own country profile as far as the key policies and guidelines that exist. Next slide. I believe this is where, okay, we're going to go to a live demo, and I think that we need to be able to have Gerard Lopez share the screen. Is that true? Okay, so what you're seeing here is our policy portal. And we're going to go through a case in which, what if you were to ask, how many countries have a policy that pregnant women should have 8 or more visits for antenatal care? And 8 or more visits specifically is our current recommendation. So here we're demonstrating that you can look at all and you can see how many have at least 4 visits, at least 8 visits, and less than 4 visits. And you can see that the majority of countries have at least 4 visits, but we are having at least over half of the countries reporting that who participate in the survey reporting that they require at least 8 visits in the bar. What if then you wanted to know, does my country and a neighboring country have a policy that a pregnant woman should have 8 or more visits for antenatal care? And what we're looking here is, believe, at Kenya. Okay. And you can press on Kenya and get that information, but you can also press on the bordering countries of Kenya and also see what that information is. And then you could see, for instance, Kenya's 4 visits, but Tanzania reported that they have 8 or more visits. And you'll be able to say, well, why is my neighboring country different than mine? Why were they able to get to see 8 visits, get a policy of 8 visits, and my country has not, doesn't have that policy yet? So, okay, so Tanzania has 8 visits and my country, Kenya, does not. So how can I find out what their policy looks like? What can I do? And you can see that here we're going to another tab where you can look at the documents and you can pull up what you want is Tanzania, and you want to see antenatal care, and you search for that. And then several documents will come up, but you can go, for instance, to the antenatal care guideline and you can look at it and see, what does it say? And how did they get to have a policy with 8 visits? And how is their policy put together? And you can use this to help formulate your policy in your country if your country, you feel like your country does not have a sufficient guideline. So, so anyway, and then you can also, and here we're looking at Kenya, look at, let me just look at my country and see what my country has. And here we have the general demographics, but we also have information on different policies in sexual reproductive health, maternal newborn child, adolescent health, violence against women. And we can go to the next page, give it a second. someday we'll have a faster way. And here is the second page, and you can look at maternal newborn health and see what all the policy laws and guidelines are, and if they exist, and when that came up. Look at the child health, it has some information on coverage, and then look at the policies, and then adolescent health, and so forth. And you can like print this out, and you could use this to go and advocate for like, why doesn't my country have X policy? Why isn't this there? And so forth. And I think that is it for the policy survey.
Thank you so much, Dr. Diaz, for that brief run through, and for also pointing out some of the places where people could look at to generate their advocacy asks. That's really helpful. If you can, Vincent, if you can take me to the next slide.
So now, shall I go? Sorry.
Yes.
Okay. So now I'm going to talk about the Child Health and Wellbeing Dashboard. And I want to let you know that this exact same dashboard is on the WHO site, on the UNICEF site, and CAP 2030, which is Children in All Policies website as well. And it's in support of the Convention of the Rights of Children. Next. So this is a dashboard that we developed together that allows policymakers, governments, and organizations to easily monitor and compare a selection of indicators on child health and well-being by region, age group, and income. And as you can see here, you start seeing some color codes and you see some age groups, and we're going to go through that further. Next. So this dashboard is meant for governments, for international bodies, for country leads, for health experts, for health sector workers, and for funders. Next slide. So I'm going to go a little bit of how we developed this dashboard together along with a working group from with different partners. And we looked at the Convention of the Rights of the Child, and we decided to put in these 4 domains: survival, be healthy; protection, be safe and fairly treated; development, be educated and trained; and participation, be heard and engaged. And we included some additional, what you call like cross-cutting domains, contextual factors, which means factors about the environment, for example, water and sanitation, and policies. And what we did is we used standard age categories that have been recommended by WHO for disaggregation of health data for children and adolescents. And so you'll see the neonatal period, the postnatal period, 1 to 4 years, 5 to 9 years, 10 to 14 years, and 15 to 19 years. Next slide. So we wanted to make a dashboard where you see, as you saw in the beginning, those round circle bubbles with colors, so you know you're on track or off track. And we had to come up with an agreement, first of all, of 1 indicator per domain. We're not going to like put tons of indicators in there. It's not helpful. And by domain and by age group. And we select these based on the following criteria: evidence of effectiveness, inclusion in other global initiatives, and that the information is regularly collected. So we would have information on most of the countries. But then we had to try a threshold. So how are we going to label something? Red is not on track, yellow is as in the middle, and green is right on track. And so what we did is we assured consistency with existing global and regional targets. For example, for the SDGs, many of them have targets, and we just used those. And then reviewed the distribution of data values across countries for each indicator. Country values were then color coded according to to indicate country performance against these thresholds. Next. So the country data in the dashboard is divided into age categories. And we're just showing here 0 to 27 days. And then I told you the different ages already. Next slide. And then within each age and across, we have the domains, as I already mentioned, which was survival, protection, development, and participation. Next slide. And then there's also context and policy indicators. Those are all going to be the same color. We haven't put any thresholds in those. It's just to give you an idea of what the environment is like surrounding in each of the countries. Next. So each data point is color coded. And there's a key that lets you know green is good progress or target met, moderate progress or on track, red needs attention. There's a kind of black that's not applicable. There's white if there's no data available from the last 5 years. And there are some where there was no cutoff display, which is showing you what the results are and not color coding it in a specific way. And circles can be split to indicate that the data is disaggregated in some way. Mostly it's just aggregated by gender, so you can get information on a male and female, but there's one indicator, which is reading or math. It's disaggregated by reading or math for the proficiency. Next. So, so how would you say, okay, well, I'm on a little circle here, and I see that it's 63. I don't know what that means. And I don't know where these data come from. So you just hover on top of the circle and you can view, and it'll pop up and you'll see that it's what the indicator name is, how it's disaggregated, if it is or isn't, what the value is, if it's a %, what the year is, and where the data come from, and what's the definition, and how is it split by the different colors, as I told you before. Next. And you can filter by country and region as well. Countries are ordered alphabetically by default, but the first set of buttons rearrange them by region, or you can do it by World Bank income group. When clicked once, a button will simply reorganize the countries in the chosen groups. And when clicked a second time, a drop-down allows users to select specific regions to view. Next. And you can filter by age. The second set of buttons are filters that allow for selecting and viewing data for specific age groups. And context and policy indicators can be ticked or unticked in the domain age. So if you were looking at 0 to 27-year-olds, but you also want to see the context and policy right next to it, you can have that as well. Next. Okay, so now we're switching over to the live demo, and I believe Gerard needs to screen share. So let's say I want to compare my country to other countries in my region and see how well the country is progressing. So we're going to go to the Afro region. So we're going, and by the way, you could choose whether you want SDG regions, WHO regions, and UNICEF regions. So we're choosing the WHO Afro region here, and you can see all the regions in that country. And then I want to know again about Kenya. So you can highlight Kenya and select Kenya, and you could see Kenya itself. But then you say, I want to see how Kenya compares to another country. And in this case, we're comparing Kenya to Ethiopia. So just by clicking on there, you can see Kenya and Ethiopia. And then going through the bar underneath, he's demonstrating how you could see what the data is by hovering over the dot. And if you go scroll on the bar underneath, you get all the way across to see all the different information. And so this is a way of comparing how well your country is or is not doing. And again, when you hover over the dot, you get all the information about what the indicator is, what the value is, what the definition, where it comes from, and how it was coded, yellow, red, green, etc. And that's it. Thank you.
Thank you so much, Dr. Dias, for taking us through that and for pointing out the different meanings of the two and the demo. If you can bring up the next set of slides. So over to you, Jennifer.
Thank you so much, Pauline. And I am really pleased to be with you all today and to represent the Countdown collaboration and the profile production team to present to you the Countdown to 2030 profiles. Next slide, please. So just to note that these profiles are generated for all low and middle income countries. Next slide, please. This is just to reiterate that the whole process of putting together these profiles is done through a collaborative effort. So I've listed here some of the key organizations. The UNICEF team is responsible for the overall production of the profiles, working very closely with University of North Carolina at Chapel Hill and North Carolina State University, as well as in close collaboration with the Countdown to 2030 Technical Review Group. Next slide, please. So basically, this is just an outline of what I'm going to cover. I'm just going to describe to you a little bit about what the Countdown to 2030 country profiles are, a little bit of detail on how they are produced, and then we'll showcase each of the pages of the Countdown profile so that you get a sense of the contents of them, and then a little bit of a description on how these can be used. Next slide, please. So overall, these country profiles are meant to be a tool to amplify and accelerate action and accountability for women's, children's, and adolescent health. The very first set of Countdown profiles were launched in 2005 and were originally focused on child survival. Over the course of the years, that remit has expanded to cover the entire continuum of care for newborn child and adolescent survival. And then also just to note that the emphasis of these profiles is on intervention coverage, and there's a whole range of information that helps explain why intervention coverage values are high or low for particular countries. Next slide, please. So this is just to give you a sense of the overall contents of the Countdown profiles. So they currently include 3 pages plus a bonus page, and I'll describe to you what that bonus page is on the next slides. As I've already mentioned, the profiles cover the continuum of care for maternal, newborn, child, and adolescent health and include a whole range of information relevant for a country to use. Also on the profiles are included the latest available data for each of the indicators that are presented. And then also critical to note is that there are companion annexes that include the metadata for each of the indicators. And users are able, when you go on the website, you're able to download the entire data set for all low and middle income countries, or you can download the data set for a specific country of interest. Next slide, please. So this slide is just to give you an overall sense of the steps that are involved in putting these together. As I noted, that slide that showed you the team, this is just to give you a sense of the process. So it's iterative. It involves a lot of engagement with the Countdown technical working group to ensure that the content is most relevant for sort of country priorities, as well as making sure it fits with global accountability frameworks like the SDG. Next slide, please. So this is just a slide to give you a sense of the breadth of and range of data sources that are included on the profile. So all of the data that is included on the profile are standardized through data collection processes. You've heard about the mix, you've heard about the UNIGME. So those are the types of data sources that we include. And also it's really critical to note that each one of the data points has gone through a country consultation process and are publicly available. Next slide, please. So now I'm going to walk you through very quickly the overall contents of each of the pages of the Countdown profile. So the first page you can see covers 3 sort of topic areas. One is all on the mortality. So you can see some of the charts there that show the trends in mortality for child and maternal. There's a map that sort of gives a sense of the distribution within the country on how they're doing in reaching populations with key essential services. And then you can see here we also have the continuum of care chart that shows where countries are, how countries are doing in providing services across the RMNCAH continuum of care. And then there are other charts here that provide a lot of demographic and contextual information so that whoever is looking at this profile can understand how these values fit with key facts of the country, including fertility, population trends, education, early childhood development, and other factors. Next slide, please. So moving on to slide 2, this covers around 4 areas. And again, just re-emphasizing that a main focus of these countdown profiles is to stress intervention coverage levels. So here you have a whole section on nutrition, which is a key determinant of maternal newborn child health, including both nutritional status as well as coverage of a core set of nutrition related indicators. Then there's that continuum of care chart that was on the first page is further broken down, so you can see some trends in key interventions for maternal and newborn health and for child health. There's also here, of course, recognition that environmental determinants are critical for health. And so we have key interventions shown here for WASH. And then there's also an additional set of equity indicators. Next slide, please. I think we might have a delay. Oh, back, perfect. So this slide, you've heard a lot from Teresa about the policy survey. So a lot of that data is reflected here. This third page provides information on specific legislative policies, on some key indicators related to governance. There are other issues here on service delivery, like, for example, human resource density. There is information on financing, both domestic and official development assistance. And then there's some additional information here to help the user interpret some of the acronyms and other types of information on the profile. Next page, please. Next slide. So this one is just to give you a sense of the bonus page. As you can see, this is quite a rich graphic of showing all of the causes of maternal, neonatal, child, and adolescent deaths. Because it contains so much information, we decided to create a full page for it. And then this way you can kind of see how the distribution of causes changes over time over the life course. Next slide, please. Yes, next slide, or just keep one more. So this is just to also give you a sense that similar to some of the other demonstrations you've seen on interactivity. So the profiles that are available on the webpage, you can click and hover over particular elements and additional information will pop up, including the metadata. This is also helpful because although all that information is in the annexes, it's just more user-friendly when you're interacting with the profile to be able to see that pop up when you're hovering over an indicator. Next slide, please. So what is the point of developing these profiles and how can these tools be used? It can be used by all stakeholders and mainly for accountability purposes, for planning, and for advocacy and for research. So for example, civil society organizations can take a look at a country profile, identify where there is progress and where there is gaps, and use that information to hold governments and development partners to account for progress for women, children, and adolescents. Similarly, these tools can be a useful piece of information for governments to use during planning processes. For example, the annual review process. They can take a look at this and have some of their decisions be based on the evidence in those profiles for new plans or for policies to support women, children, and adolescent health. And then lastly, of course, this is an enormous database behind these profiles, and researchers can delve further into the data that you're seeing on the profiles to try and explore patterns and why certain countries are performing better than others. Next slide, please. So I know this is a very busy slide, but we're very excited to be announcing the launch of the very first set of regional profiles. As you can see, these regional profiles take as the core the national profile display. Just another point to note is that there are going to be sort of standardized pages for all regions, and then work is underway by the Countdown Profile production team to work closely with regional offices to develop customized pages that reflect the priorities in that region. Next slide, please. Just a little bit more detail about these regional profiles. So again, they have interactive features. So a user can go in and take a look at the regional aggregates if they're interested in seeing how well the region is performing overall. And then if they're interested, there's a country view that enables a closer, deeper dive into the specific country. Next slide, please. So this is again just an illustration of the type of information that's available on the regional profiles. These are two different charts. I'm just going to explain the continuum of care chart that you're seeing on the left-hand side shows that the bar is the regional aggregate, and then each one of those dots reflects a specific country's value. So this way, a user can take a look and see how well the region overall is performing, and then get a sense of the range of performance across the countries in the region. Next slide, please. So again, just another nice feature of this regional profile is that, as I noted with that cause of death chart, it's quite dense and has a lot of information. So one of the features of this regional profile enables a user to click on how much information they would like to display. So for example, for these cause of death charts, a user can just say, well, I really only am interested in the top 5 causes of death. And so that's what you can do to customize the experience when you're using the profile tool. Next slide, please. So this is just to note that another important step that UNICEF took this year was out of recognition that the Countdown profiles are part of a large set of profiles that cover the RMNCAH continuum. So you saw the demonstration of the child health and well-being dashboards as well. So UNICEF designed this web page where all of these related profiles are in one place, so a user can go there and also understand how they relate to one another. So what type of information is in the child health and well-being dashboard
les unes aux autres.
And then there's also other kinds of information there that cover the RMNCAH continuum. Next slide, please. And that is all the demonstration of the Countdown to 2030 profiles. I just want to note that the next round of these profiles will be launched on February 9th to take advantage of the new maternal and child mortality estimates that are coming out shortly. And we'll keep you posted on that webinar. Thank you so much.
Thank you so much, Jennifer, for taking us through that. And there is a question that's just popped up for you. So we're opening up now for questions. We'll spend the next 17 minutes on questions. Some of them have been answered on the chat, but I think we'll highlight some of the questions so that everybody can be able to hear. I realize not everybody is able to monitor the chat, but while also they're listening. So a question for you, Jennifer. The term post-neonatal in the countdown refers to the 1 to 12 months, like in the mix or DHS, or to 1 month to 59 months. Please provide that clarification.
Thanks, Pauline. It's 1 to 12 months.
All right. Oh, thanks so much. There are the questions. So I'm just going to try and look at some of those. But before I go to some of the questions on the chat, let me start by a question that's I've been thinking about. And I asked this question because we've all gone through a period of global disruption by COVID-19. And this is a general question any of the presenters can answer. To what extent did the pandemic disrupt data collection, especially looking at countries and the scramble they were going through, trying to, to respond, sustain essential health services. Did they really have bandwidth to get data collected, data processed, and go into all these different tools? So that's a general question for all of you. As you think about that, I'll pull up additional questions that have come up. So if any of the presenters can open the mic and respond to that. Thank you.
I'm going to suggest that the mix is the one that needs to kind of answer this most. Our policy survey was never planned during the pandemic, so it didn't disrupt that data collection because it wasn't planned for that time period. The rest of the data that we're presenting were from others and aggregating them together. But I think the primary data collection with the population-based surveys was disruptive, and perhaps the speaker of the mix would like to say something.
So Bo, over to you.
Thank you. Yes, it had a massive impact. It continues to have an impact because even though many of us would like to think that the issues are over, they are not, obviously, and it has changed a number of things in how we do it. But if we look back at the surveys, I mean, from the mixed point of view, exclusively, we got incredibly lucky in the sense that we did not have that many surveys fielding at the time of the what should I say, the really big lockdowns. And secondly, those we had in the field, I think we were around 5 in the field. 3 of them we assessed to be complete enough to close field work and not needing to go back. There are some elaborate descriptions of that in the survey reports. In Kosovo and Argentina, the 2 that I remember right now, where we analyzed. I think the 2 surveys were quite substantially hit in Malawi, where we were about halfway done, and basically had to reevaluate the whole situation. Luckily, the lockdowns were lifted and the situation not as intense as in other places of the world, and the field work was completed later. In one survey, the field work was stopped and started and stopped and started, I think 4 times, which was really detrimental, looking at how we work, right? In terms of funding expires, money needs to be spent. You have to go and find another bit of money here and there. It was a complete disaster. But generally speaking, we were lucky. And it also sort of looking ahead and how things have moved forward in the world. Just before the COVID, there had been quite a move in the world of household surveys to look at the mixed methods in the sense of combining face-to-face with telephone surveys, with web interviewing as well. Obviously, that is different across many different country contexts across the world. From the mixed perspective, we were lucky that we had just basically started a pilot in Belize for our longitudinal phone survey, so we were able to even respond to that and conduct phone calls on a mixed sample in relation to COVID measures, right? How the population were acting. So that was very, luck in unluck from our side. Lots of other telephone survey methodologies were implemented very fast. And that, I wouldn't say that it has taken over the world of surveys. Nothing can replace face-to-face, as many of you know. There are things that you cannot do on a phone survey, but it has really escalated and improved lots of things in how we save some money and become more efficient in how we approach. So there are some good aspects of this, but we keep being affected. There are more ethical considerations, right? We have to be more on top of the interviewer and team protection and respondent protection in terms of face-to-face interview.
Thank you, Bo.
Over.
Thank you. Another question that directed to you. Do you find big differences between your survey results compared to country surveys, for example, census? And if yes, what do you do to ensure harmonization?
Well, maybe it's suggested that that I can start on this. It's good that I turned off my camera because I made a big sigh. Because yes, we do. For us on the household survey side, we generally speaking across most of the world utilize the census to design our sample. But if we look at some of the data that is collected in census, I mean, I know that I say that it's difficult to do a household survey, but it is incredibly difficult to do a census. The data quality in a census, it's a very fragile instrument because you need so many interviewers to do exactly the same thing and be sure that they do exactly the same thing. So there are census issues, and we see, what should I say, quite large differences in results when we look at some of the result outcomes, some of the indicator outcomes of censuses. Duncan can explore more on that in terms of the mortality side and demographics for sure. But I mean, it's difficult to do a census. It's problematic to do a household survey too, but we have the opportunity in a household survey to sit longer with respondents and to take more care in how we collect the data. And I don't know, it's unfair to say that we generally have better quality because in household surveys, we have huge problems as well. So yeah, over to Danshan.
Thank you, Bo. Maybe just to first highlight, mixed surveys also are owned by countries. I think it depends really, which indicators we are talking about, and also, across different surveys and census, the results may be aligned, maybe not, as Bo pointed out. And for child mortality indicators, we usually find that the mortality collected through census are underestimated. That's the usual case, but it could be different. In some countries, the census may even produce overestimated results. So because the census only using the household death questions, very simple, and usually ask the household head who may not have good knowledge about deaths occurred in the household. While surveys ask the mother of a child or their of her children, so she may have better knowledge about the death. So there are different situations. We do need to conduct very in-depth quality assessment to find out why we have discrepancies, whether it's due to the sample size issue or there's no sample size issue, but due to the census on the reporting, etc. So a lot of work, as I mentioned earlier, needed to be done to figure out the discrepancies and to see how we can adjust the one of the survey or both. Sometimes we may not have the methodology to adjust because we can understand from some indicators that one survey may have problems, but we don't know about the magnitude of the estimation or other data quality issues. Yeah, I'll stop here.
Thank you, Dr. Yu, for that response. A question for Dr. Deyers on the policy database. The RMNCAH policy document repository, can you access provincial governments' policies? strategies or guidelines for decentralized countries. And here gives an example of Pakistan. And if not, there is a suggestion that this needs to be looked into. So Dr. Diaz, over to you.
Yeah, that has been one of the challenges for the decentralized countries. What we have tried in this next round is to at least, the very least, identify which of those countries are. It's really hard we're going at a national level, and it's really hard at a national level to ask them to compile all the policies at the provincial and state level and then send them up, unless they already have something that exists. So it's up to them what they want to upload and provide to us. It's up to each country. But it's usually a very difficult process, and that is one of the limitations. I'd have to say, though, this is one of the most unique databases in the world, and that's and not, countries don't usually have all their state or local or provincial policies in one database at the national level. So at the very least, we have some information, and there is limitations related to the decentralized countries, but we haven't figured out a way to deal with that, because it's a real burden to ask the country to go and try to collect everything when they don't have such a database and bring it back up to us.
Thanks. While you're still there, can you just explain a little about the blue dots? I know that question. Yeah, just explain for people.
The blue dot means we didn't, we had a red, yellow, and green. We didn't classify it. It doesn't mean we could have classified it. It was a decision made by the custodian of, and when we custodian for all SDG indicators, for example, for all of them, there's one agency that's the collector of the data. They did not want us to classify the thresholds, and this was in the educational domain, mainly because they were actually having countries create their own thresholds, and they weren't yet already. So that's why it's just blue. It's not like we could not have. The decision was actually not to do that.
All right. So thank you very much. We only have very few minutes remaining. So first, I want to thank the panel for all your presentations and also clarifying the questions both verbally but also on the chat. You've also shared different links that to the databases, to the tools, to the resources that can be used. And just note what Jennifer highlighted, the one-stop shop. I think it will be a good place and for people to be able to go to and be able to link to multiple resources from that one-stop shop. Thank you so very much for your availability and sharing your expertise with us. I think to all of us, the advocates, you note that there are really good tools available out here, and that we have the opportunity to link to these tools, to pull from these tools, but also to engage with our governments. They provide an opportunity for engaging with our governments for advocacy, but also when they're doing consultations. I would have asked a very quick one, but I think we might just not be able to. When capacity building, I think, is done by UNIGME, Dr. Yu, if you take just 30 seconds to answer this, is it just covering governments, or does it also cover the partners that work with governments? If you can quickly respond to that.
Sorry, my connection was poor when you asked the question. Could you repeat? Sorry about that.
When you do capacity building, because you have that highlighted when you made your presentation, is it only to governments, but also to partners that work at country level with the governments?
Oh, thank you. Yeah, we target Ministry of Health and NSO, government officials, but we also invite UNICEF and WHO field offices and some partners. If there's a university, interested in participating, then we also invite them. So we are very flexible. If there's a need, we include in our capacity building workshops and country missions. And we always leverage partners in the UNIGME work. We also sometimes rely on some academic groups to improve our methodology, for example. So if you are interested, feel free to reach out. Welcome any kind of collaboration if there's any opportunity. Over.
All right. Thank you so much. And I think with that, I'll bring it to a close. Some of the links have been shared, but you will also receive from PAI, the GFF Civil Society team, the links as well as a quick report from this webinar. We thank you so much for staying on, for your great questions, and look forward to the third session of this series that will be coming up I think in Q1 of 2023. Happy holidays, all the best to all of you and your families, and see you in the new year. Bye-bye.
Thank you.
Cette chanson, elle est pour toi, Marie Munkuru. Zach Prod. Aya foi negame, dia wana le mafoie, mikadi kawolo baka numbo. Aya foi negaye ne manyogo ye. Mama ikari ne oro ba ikari. They're my best, they're my queen, they're my shade. Mais toujours tu supportes, jamais tu